in a word, they kind of debunked the notion that you need tech bros and you need a gazillion amount of dollars to have strong AI capabilities. So I thought it was very ironic that a Chinese AI company has knowledge of US history, whereas ChatGPT didn't.
When it comes to the vaccine stuff, look, let's just all hope and pray that we don't have a pandemic in these next 4 years, because otherwise this dude is gonna be like, what vaccines? No vaccines. Forget about vaccines.
Hello and welcome to Debunked, where we discuss healthcare news without fluff, without fear or favor. I am Arundhati Parmar, Editor-in-Chief of MedCity News. We are an online publication focusing on innovation in healthcare.
And I'm Samir Batra. I'm the managing partner of HIP, a opportunistic healthcare venture firm.
Now, Samir, January was such a busy month. Not only did we, both of us, go to the annual JP Morgan conference, healthcare conference, where 7,000 to 8,000 people come to San Francisco, wheeling and dealing in the world of biopharma, health tech, so on and so forth. We also had the Trump inauguration, flurry of executive orders, with the goal of disrupting business as usual, but I think what we ended up with is a lot of uncertainty. And then, of course, we had RFK Senate hearings. I don't know how to quite describe that. Crazy a little bit. I don't think he did himself too many favors. But where I wanted to start is neither of those. Wanted to start with this very interesting company out of China that we suddenly heard about called DeepSeek, an AI company that has created a large language model called R1. And what they essentially showed was you don't need a gazillion amount of dollars to basically innovate in AI. Their whole idea was create this open source model that people can use for different applications. And in a word, they kind of debunked the notion that you need tech bros and you need a gazillion amount of dollars to have strong AI capabilities. Now, this has rattled the stock markets. People are calling into question the future of companies like NVIDIA, which is one of the most prominent names in artificial intelligence these days. They make the advanced graphics processing units that are needed in AI applications. So I guess let's start there. What do you think of them? What are the applications in healthcare? And how scared should American AI companies be?
Yeah, and really quickly, right before that, JPM week was an interesting week, but this year it could have been even had a different tone had it happened after the inauguration. So This was all sort of pre-inauguration. We're all like, yay, we don't know what's going to happen.
Yeah.
Imagine what JPM would have looked like post-inauguration.
Yes,
but anyways, so DeepSeek,
yes.
right? So you said it's an open source model, right? Technical capabilities of innovations to be built on top of it, right? Probably more cost effective, right? Because to your points. But here's the thing, again, I'm going to say it from an American perspective. How much trust are you going to put into a Chinese AI?
Oh, God.
Been beat up. I'm just saying, it's been beat up a lot, okay?
Yeah.
Okay, especially with the complexity that you bring into from a healthcare perspective, right? Security, quality control requirements, all those sorts of things. The trust factor is going to be really interesting. I just think from a longevity perspective,
True.
Right? Okay, but the use cases, of course, are endless, right? I mean, you have personalized medicine, disease and risk progression, drug discovery, development, patient engagement, monitoring, right? So I think there's a lot there.
Yeah.
So
I mean, that's interesting. The trust point, I think, is well taken. I think for me, the takeaway was you don't need that much money to develop something powerful. I'm not saying every company out there go and build a model off of DeepSeek. I'm not saying that, but I'm saying that it takes away from the dominant narrative in America is that you have to have huge data centers. You have to pour millions and millions of dollars into building your AI capability. And Trump has sort of touted that, not Trump that, he has touted that. the whole news conference with Sam Altman and however much billions of dollars we're pouring into it. So I think from a journalistic perspective, the idea that, hey, you don't need that much money to build something powerful, I think that to me was really interesting. Now, I did a journalistic search on it.
Yes.
I went to DeepSeek and asked the same question that I asked to ChatGPT, which is, why is healthcare so expensive in America? Now, there were similarities. Both the AI engines listed 10 reasons. Some of them were very similar. A couple were different, like, for example, DeepSeek put medical education as one of the reasons that medical education is so high in the US, so that leads to higher costs. But there were other things that I thought made me think that DeepSeek's answers were more thoughtful, a little more probing. So take, for example, chronic disease management. So both DeepSeek and ChatGPT states the obvious first. They say there's a high prevalence of obesity, obesity, diabetes, and heart disease in the US. And so managing those chronic diseases leads to higher costs because they are expensive diseases to manage. That's what ChatGPT says and stops. DeepSeek says that these diseases, yes, are very prevalent in the US, but these are lifestyle diseases, and those contributes to the lifestyle factors contributes to these diseases, and the high healthcare system is bearing the brunt, which I thought was really interesting because it's trying to get to the root cause of why we have high prevalence of this. And, I mean, it would have been great if they mentioned food companies and nutrition in the US, but that's probably expecting a little too much in terms of an AI model. The other bit that was really interesting was how it looks at, how both these engines looked at insurance. Okay. So ChatGPT states the obvious. Premiums are high, deductibles are high in both private plans and employer-sponsored plans, and they continue to rise. And this leads to higher costs in general in healthcare. Again, DeepSeek goes deeper, no pun intended. It goes deeper and it says that there are multiple layers of profit-taking entities in the United States. It mentions PBMs, it mentions private insurance companies. This reasoning of profit motive is nowhere to be found in ChatGPT. And then finally, both the engines provide a little bit of a conclusion after I asked them about the reasons for high healthcare. And again, ChatGPT's was simple and obvious. You need to systematically reform high drug prices, you need to reform regulation, you need to reform the structure of healthcare delivery, and then all of this will lead to prices going down. ChatGPT actually demonstrated something that, not ChatGPT, DeepSeek, demonstrated a knowledge of history. It says that reforming the healthcare system in America is a complex and politically charged challenge. It also said the Affordable Care Act tried to take a stab at this, and still, despite that effort, prices remain high in the US. So I thought it was very ironic that a Chinese AI company has knowledge of US history, whereas ChatGPT didn't.
It's not iron. There's no irony here.
Why not?
Come on. Many foreigners know more about Americans than Americans do themselves.
True.
I mean, they study this, right?
Yeah.
I mean, just look at the basic level of how much education we're given from a history perspective, American history perspective. Heck, I could challenge you that probably Europeans would be able to name all 50 states over some people in America. Right?
True.
So I'm not surprised about that. But anyways, I'm sure there's other AI news to discuss, right?
Yes.
So what was the term most used that you heard at JP Morgan? I'm sure it was AI related.
It absolutely was AI related, and the term was agentic AI.
Okay, wonderful. So not generational now. What the heck is agentic AI now?
So we have heard generative AI, of course, the ability to generate information based on questions that you ask. Agentic AI is a step further advancement, more powerful advancement, and what it allows artificial intelligence algorithms to do is that it allows them to act because it has a set of information. It's able to have agency and act on those decisions as opposed to waiting to be told to do something. So I thought that was really interesting, but I'm wondering what kind of applications we could even have in healthcare.
No, I mean, this could be crazy. I mean, first of all, it's, let the machine take over, right?
Yeah.
So, I keep thinking about my watching Terminator back in the day. But I mean, look, honestly, like take claim management, for example, right? So AI goes in, reviews claims, flags issues, thinks about interventions, and automatically sends denials to patients or approvals to patients. I mean, that's crazy, right? So then that's where your agency piece is happening. That would be really interesting. I mean, talk about efficiency, right? You're totally taking out any sort of next step that needs to happen, right? Eligibility check. Imagine, right? You need to have prior authorization or eligibility checks, and then you're pushing out required documentation, or you're doing a pass or fail on eligibility. So I think that's really interesting. So analyzing data, how about this one? Analyze data, create a care plan, and push it out to a patient. So I think there's a lot of ways that could happen. So I don't think, to me, that, I'm not sure it's a buzzword. I think it's the next evolution, right? Like, you've sort of had basic AI, like you said, you have generative AI. I mean, if the machine is already reviewing data and telling you what this data means, well, the next step usually is like, well, here's what I would say you should do with the data. But this is sort of like taking a leap and saying, not only am I telling you what you should do with the data, but I'll go ahead and just do it.
Yeah. I mean, and that's the part that's really interesting to me. When we have the conversation of AI and healthcare, the phrase that we hear most often in the last couple of years is humans in the loop. Humans in the loop. And the idea is that, well, do no harm is paramount in healthcare. So you need human beings to oversee what AI, what technology, what automation is doing to, safeguard any patient harm. But what I thought was really interesting was that Novo Nordisk, he's a senior vice president of data science at Novo Nordisk. His name is Thomas, and I hope I don't butcher his last name, Senderovitz. He said something really interesting at a panel during JPM week. He said, so first let me say what kind of AI that he works with. So they have developed a clinical trials infrastructure which pulls in all kinds of data, and then AI can generate insights from that data. And so he's coming from that perspective, from the biopharma world. He talked about how obviously they have humans in the loop, but he raised the question of why do we need humans in the loop? And the idea is that there is an assumption that we humans make that human beings have the best judgment. And he said, should we have that assumption? Because, of course, there are multiple examples in human history of poor human decision making. So, do we need humans in the loop in healthcare?
I mean,
it's a tough one.
It's a tough one, but I mean, look, I'm going to give you my biased viewpoint. I'm scared of the machine taking completely over. I mean, it is, right? I mean, I don't care. I mean, yes, and healthcare for sure, but I think in general, I mean, it's like, then what the heck is the human going to do, right? So 100% there needs to be rules and guardrails. And I think it's going to be maybe something that with like agentic AI, it has to follow some guardrails, some thresholds, some parameters, right? So maybe you're sitting there saying, I'm going to let you take action in a container, right? So that is not going to, create human harm. I don't know, whatever you want to call it. So maybe in the short run, there needs to be sort of a human sign-off. So my example, let's just say, look at my example of like care plan, right? So you review patient data, you create a care plan. How about you review patient data, create a care plan, and then you just send it to the provider and say, look, man, I just need you to say yes or no. Right? And if you say no, I'm going to go back and I'm going to adjust
You meaning the AI?
AI, yeah, it is the AI. I'm giving the AI human abilities, right? Hey, buddy, like I analyze the data. I need you to just do yes or no. Right? Okay, sure, go. Okay, go, then it just delivers it. Right? But if it says no, okay, then maybe it's sort of asking, the AI is prompting you, right? And saying, well, what do you want me to change? Right? So let me go ahead and change it. So again, it's assisted agentic AI.
I love that.
How
New
about
term.
that? New term, right? But I'm just saying, right? Like, I think all of us agree, even companies that are raising zillions of dollars in the AI space, even they themselves are sitting there going, oh, when it comes to final clinical decision making, yeah, let's not go there.
Yeah, because there are liability issues also, right?
This is the whole point
Yeah.
in our entire U.S. healthcare system. Who gonna pay for it?
Yes.
Right? Who's gonna pay for it? Who's gonna take that liability? So I think that's another question for agentic AI, right? Like, dude, if you're going to make that step, who's going to cover that?
There is no algorithm that can answer that question.
Right? So my point is that I think maybe an assisted AI, you know, sort of with guardrails, parameters, right? Some sort of automation that sort of gets the human involved, but in a very light manner, right? To sort of say, look, I'm going to go ahead and take care of this. You know, speaking of AI, maybe we'll have an AI president one day, right? Like, let's just have the AI be president, right? Based on data, it's making decisions. How about an assisted AI president?
Okay, you know what? Given that you've gone the political route, I have to.
Did I open the door?
You have opened the door to actually something that RFK Jr. said at the Senate hearing, which I thought was so freaking crazy. No one pushed back because no one knew to push back. He got a question from a senator in Wyoming saying, you know, hospitals are closing, rural hospitals are closing, and how can you, as potential HHS secretary, address this problem? And can I get a commitment from you? That's what the senator asked. Can I get a commitment for you that you're going to look into this problem? And he absolutely said, yes, it's a huge problem. It's a bipartisan problem, something that Democrats and Republican senators have said. And then he said something interesting. He said President Trump has basically urged him to solve this problem using technology, AI, and telemedicine. And then he said he had seen some innovations. Cleveland Clinic, and I'm quoting here, Cleveland Clinic has developed an AI nurse. And I'm going to paraphrase from here. That AI nurse, has now the same diagnostic capabilities as a human, so it's indistinguishable from a human being. And I was like, no way in hell does Cleveland Clinic have this capability. So I just emailed the Cleveland Clinic Public Relations Department and I said, hey, this is what RFK said. Do you have an AI nurse currently?
Care to comment?
Care to comment? And they basically said, well, thank you so much. We thank the, Mr. Kennedy for crediting us with this innovation, but we have not developed an AI nurse.
Right.
I think what has happened is what is happening in many healthcare systems. There is a company out there in the Bay Area called Hippocratic AI that has developed an AI software model, but that is an AI nurse. However, it is not diagnosing anything. It is doing follow-up. It's chronic disease management. It can talk to a person on the phone, like a patient on the phone, and make sure that they're following protocol and all of that after being maybe released from the hospital or an acute incident.
Sure.
It is not making any kind of diagnosis unless Munjal Shah and Hippocratic AI have suddenly decided that they want to go the diagnostic route. That was not what he said when I met him a few years ago. So I think he saw a version of Hippocratic AI. I have no idea if there's some kind of stealthy company out there, but heck, Cleveland Clinic is not developing an AI nurse.
Yeah, I mean, again, I think the environment, it's not that the technology doesn't exist.
Right.
It's that the environment does not exist, right? To be able to sit there and say, oh yeah, let me just go ahead and turn it over to this machine to diagnose and treat and do everything. Right, so I don't think that's there.
Yeah, that capability is not there yet. Although I do agree with you. When you ask the question, "What's a human being going to do?" That's a very good question. It's a Star Trek type of question. What do human beings do when maybe money is no longer motivator and technology has far exceeded its capacity?
Or maybe you give, I don't know. Do we get to the point where you give patients a choice? Hey, do you want to opt into the AI model and your cost will be less? No, I'm saying this right. You sit there and say, hey, look, you can go the AI route.
Yeah.
Cost will be less. If you want AI-assisted human in the loop, it's going to cost you this.
I mean,
then it's on you. You're passing the liability on to the consumer, to the patient, saying, look, you take it. You want the machine to make all the decisions and follow everything. Yeah, you can do that. This will be the cost. Your out-of-pocket cost will be this.
Interesting. I like that example. I mean, look, AI is coming, whether you like it or not. I'll just give you a very simple example. Even a year or 2 years ago, even a year ago, I would say actually, when I was at JP Morgan, you wouldn't see too many Waymos running around.
Oh my
Waymo is
God.
those
It was Waymo
cars.
crazy.
Yep, the cars with the camera on top, no driver inside. And, excuse me, and you would see 1 or 2 cars here and there. Literally in my 3 days or 4 days that I spent in San Francisco, they were everywhere.
Yep.
They were annoying some of the taxi drivers and other people driving, but I thought they were following the rules very well.
Oh, they were super cautious.
Yeah, super cautious. So AI is coming. Healthcare may be a bit of a laggard because of the do no harm, but it is coming. Now, back to Robert F. Kennedy Jr.
Bobby.
Back to him. I saw part of the hearings. I don't think I saw a lot of it, but he probably is now one of the most controversial nominees. The stuff that he has said about vaccines, I don't know how you can walk back from those, not to mention that these hearings, both from a Democratic and Republican perspective, are just nonsense. They are just a waste of taxpayer dollars because the Democrats have made up their minds that they're not going to vote. Republicans have probably mostly made their minds that they're going to vote for this person. So it becomes a show of politicians just talking and not really, saying anything, letting him answer. Again, what would he answer? Some of the stuff that he said is beyond the pale. So I'm just wondering if there is a way that they didn't give him HHS, but he is a sort of crazy character. And so he says some things that are very correct about nutrition and ultra-processed foods in the U.S. and the contributors to chronic diseases.
Sure.
So I wish there was a position that could be created where it would be like he heads it, and his job is corporate accountability in nutrition and in drug pricing. And that would save HHS from having him as the secretary, and maybe something good might come off in the realm of food safety and nutrition and all of that. That's yeah, you are not impressed.
No, that's not that. I mean, I just want to say, yes, the wackiness has started, but this is what everyone voted for.
Yeah, true.
So, I mean, why
I'm
are
not
the shock
complaining.
and awe? I'm like, oh, shock. Dude, this is what
Agreed.
America has said they want.
Yes.
Right?
Yes.
So now live with it for 4 years.
But that
Live
doesn't
with
mean I
all the
want
craziness.
him. But that doesn't mean that you necessarily want to have him as a
No, I'm not
secretary.
saying that.
Yeah.
Look, were you surprised when his defense secretary was confirmed? I mean,
No.
Look, this is just a dog and pony show.
Yeah.
It's time for politicians to doll up and get some camera time because they don't get enough camera time.
True.
Right? And so, and they're asking these dumb questions, dumb comments.
Yeah.
Half the time they don't even let the dude speak.
I know. I agree.
And then he has the same speech repeating over and over again.
Yeah.
Same damn 6 words that his publicist has told him to repeat.
Yes.
And they never answer the questions, and they just keep going.
Yeah.
So when you want to talk about him, look, he's going to get confirmed. Because you know why the Republicans are going to confirm him? Because they're cronies. They care about their mid-year election coming up. They don't want to upset Mr. Trump because he's not going to back them. And they want to get reelected. It is all political. They might think that he's a whack job, but they're not going to come out and say it. They're going to tout the practice line, the party line, right? Now, talk about him.
Yeah.
He does not even deserve a consultant spot.
He doesn't even. Oh God!
Forget that. I mean,
but
look,
he says some good stuff about food.
He does say some good stuff about food. I mean, it doesn't take a genius to. What he's saying is yes, it's like common sense stuff. Like food is ultra processed.
True.
Look at what European standards are for food. Do you know in England you can't buy Doritos because that color that they put in the Doritos is banned. So when I go to England, a lot of people are like, "Yo, can you bring me some Doritos from the US?" Right? Like there's standards out there that we can sort of mimic.
Yeah.
Right?
Yeah.
And then when it comes to the vaccine stuff, look, let's just all hope and pray that we don't have a pandemic in these next 4 years because otherwise this dude is going to be like, what vaccines? No vaccines. Forget about vaccines.
Well, that was our first episode of the year. So chaotic January, so busy. Our biggest newsmaker, Trump, is back in town. We're in for a roller coaster ride. And in the midst of that roller coaster, if you want a sense of sanity, come watch Debunked.
Sure.
Write to us at debunked@medcitynews.com. Again, I'm Arundhati Parmar, editor of MedCity News, and I'll see you next month.
Yeah, thank you so much.